We will explain about 10 tips how can you prevent breast cancer in this video. Number 1. Maintain a healthy weight. Patients who are overweight, especially after menopause, have an increased risk of developing breast cancer. Researchers believe this is because fat tissue can produce estrogen, and estrogen exposure is linked to breast cancer. Number 2. Limit or avoid alcohol. Any amount of alcohol increases your risk for breast cancer. Research shows that greater alcohol consumption is linked to higher breast cancer risk. Avoiding alcohol is ideal, but if you do choose to consume it, limit yourself to no more than 3 to 5 servings per week. Number 3. Eat a healthy diet. We recommend a plant-based diet rich in whole grains, vegetables, fruits, and beans. Incorporate brightly colored or strongly flavored vegetables and fruits into your diet. Limit red and processed meats, sugary drinks and sodas, and processed foods high in fat and starch. Number 4. For new mothers, consider breastfeeding. Studies show that breastfeeding for at least 1 year is associated with a decreased risk of breast cancer. However, the decision on whether to breastfeed your baby is a personal one. The knowledge that breastfeeding may slightly reduce breast cancer risk is just one of the many factors to weigh. Number 5. Avoid smoking. Although the association between smoking and breast cancer risk isn't clearly established, smoking is strongly discouraged because it clearly raises heart disease and lung cancer risks. Number 6. Manage stress. Although there's no proven link between stress and elevated breast cancer risk, reducing stress levels likely benefits overall health. Helpful practices include deep breathing and meditation, regular exercise that includes stretching, taking breaks from news reports and social media, seeking help from a psychologist, social worker, or professional counselor if you face ongoing high levels of stress. Number 7. Enhanced screening. Breast cancer screening can't prevent breast cancer from developing, but it can help detect it earlier, when it's easier to treat. Ask your gynecologist or primary care doctor about a tailored screening program. This may include additional or different types of imaging tests. Note, UCSF is currently leading a study of personalized breast cancer screening, called the Women Informed to Screen depending on measures of risk, wisdom of trial. To learn more about your personal risk and tailored screening, you may wish to participate. Number 8. Tamoxifen. Tamoxifen, an anti-estrogen medication, has been used for decades to treat breast cancer. A large study called the Breast Cancer Prevention Trial found that in healthy women without breast cancer, 5 years of tamoxifen use reduced the risk of developing it by approximately 50%. To decide whether taking tamoxifen is right for you, talk to your doctor. Number 9. Prophylactic, preventive mastectomy. Some patients with a very high risk of developing breast cancer may choose to have one or both breasts surgically removed. These include patients who have mutations of the BRCA1 or BRCA2 genes, a history of breast cancer, several close relatives affected by breast cancer. Number 10. Be physically active. Physical activity can help you maintain a healthy weight, which helps prevent breast cancer. Most healthy adults should aim for at least 150 minutes a week of moderate aerobic activity or 75 minutes of vigorous aerobic activity weekly, plus strength training at least twice a week.